Let's go to Kirti Narsai. She has, of course, spent a number of years working across the continent for one of the big multinationals, but now she's taken a step back, doing some research on a PhD and reflecting on her experience. And I'd really like her to share some of those reflections with us on how, in her view, Africa could build its productive capacity and competitiveness and in the pharmaceutical and healthcare sector. And what are some of the big implementation challenges you've seen, Kirti, on the continent? And what do you think we can do to member states of the continent to address these? Thank you.
Thank you, Faisal. And firstly, thank you very much for the opportunity to participate in this webinar this afternoon. I think it's a very important discussion that we are having, and like the previous speakers have mentioned, this is the beginning of a long and complex journey for us to really fully leverage the opportunities that are going to be provided to us through this Continental Free Trade Agreement. So to answer the question that you've posed to me regarding productive capacity, competitiveness and innovation, I think if we look at the pharmaceutical value chain, it in itself is complex. And if we are going to fully leverage this productive capacity, we need to really think about what it is that we're thinking about when we talk about productive capacity. And based on what some of the previous speakers have spoken about, we're really thinking about finished product manufacturing. And so far, the conversations that we've been having have been limited to finished product manufacturing. And governments and policymakers have taken a very nationalistic approach to this production capacity. However, we now have the opportunity to look at it from a more regional perspective and also continental perspective. And that is what the Continental Free Trade Agreement provides us, this market of 1.3 billion people. And that requires us to rethink how we think about production and how we think about our national policies. I think governments and policymakers have used local production to deal with issues of public health, of dealing with things like HIV/AIDS, to reduce dependencies on imports, and then also to create local capacity of manufacturing and also employment. However, we have now this opportunity to relook at how we view not only national competitiveness, but also regional competitiveness. And like some of the previous speakers have said, also what is the export opportunity, not only towards our neighboring markets, but also outside of the African continent. So these are all opportunities that lie before us, but that requires us to relook at how we view our policies currently, and also how we view the private sector investment that we would like to attract into our countries. And then, of course, there's the issue of APIs. Currently, we are importing all of our APIs, and China and India dominate the space. South Africa is looking at API manufacturing locally, but on a very small scale, and we are also at the beginning of that journey. But that API manufacturing also has its own value chain, and we need to be exploring what are the opportunities within that value chain for us in terms of local production. There's not only the final API, but there's also all the intermediates. And the intermediates then require less technical abilities and expertise, but there is also a lot of market opportunity in those areas. Also opportunities for private sector partnerships. And so those also can and need to be explored. One of the things that we haven't spoken about is vaccine manufacture. And, you know, I heard a statistic recently that says that about 70% of vaccines are manufactured in the developing world. And that includes countries like South Africa. So we should also be looking at how can we scale up vaccine manufacture in Africa. We know that under the COVID crisis, for instance, immunization levels have declined significantly, and this should not happen. We also know that vaccine manufacturing facilities have been repurposed to accommodate the COVID vaccines that will be coming onto the market very soon. But this production capacity is probably not going to be enough for what the world requires. And so these are also the opportunities that we should be looking at. And again, these are opportunities for other partnerships that we should be looking at. Then one of the other speakers, Daniela, spoke about supply chain innovation, supply chain and distribution practice. And I think supply chain innovation is an area that is not spoken about enough. We are living in countries that have very urban populations and also very rural populations. And all of those populations require healthcare products and services at some point or the other. And we have a responsibility to make sure that those services and products are supplied. However, we have this infrastructure deficit. And I had the privilege of actually traveling to many of these countries to look at what the supply chain infrastructure, particularly looking at cold chain infrastructure, is in some of these countries during 2018 and 2019. And I can tell you that, you know, there is a huge deficit, for instance, in cold storage. Which is going to be problematic, for instance, once we have the COVID vaccine as an example. And this is something that needs to be addressed and is going to become problematic going forward, but it's also an opportunity. It's an opportunity for us to think innovatively about what kinds of new technologies will we be able to use, what kinds of innovative partnerships will we be able to broker with, for instance, organizations that are not part of the healthcare sector to address some of these challenges. I can provide one example that I came across online a couple of days ago that was a partnership for last mile distribution that involved informal traders, a bank, an FMCG company, and a technology company. And, you know, that is a very unlikely group of partners coming together to solve the challenge of getting products to consumers. But this is an example of a localized solution that is tailored to the environment that we find ourselves in. And I think this is exactly the kind of out-of-the-box thinking that is required to make implementation real, to make it environment-specific, and to make this Continental Free Trade Agreement a reality in this environment. When we look at implementation challenges, I think this is one of the key areas where we find that companies in the private sector have challenges, and this has been mentioned by some of the speakers. Even when we talk about regulatory harmonization, we tend to talk about it at a policy level, but not necessarily at an implementation level. And this also gives us an opportunity to really become very granular and very practical and involve the private sector to talk about exactly what is happening on the ground and what are the challenges that are experienced by companies in, for instance, registering medicines, in transporting medicines across borders, because these are all the challenges that are experienced on a day-to-day basis. What are those distribution costs, for instance, that get inflated to such an extent that they become unaffordable to the patients? These are all the areas where I feel that the private sector can really become more actively engaged in policy discussions, right from the development phase through to the implementation phase. But we also need to relook at what those platforms for engagement look like, because at the moment they are also very nationalistic. But now with this Continental Free Trade Agreement coming, we need to relook at developing more regional platforms so that they are appropriate to where the continent is actually going and what our vision is under this free trade agreement. Yeah, I think a lot of the points have been covered by the previous speakers, but one of the points that I'd like to emphasize is we need to re-look at how we balance national versus regional versus continental priorities under this free trade agreement. And that is really going to force us to re-look at market competitiveness and attracting foreign direct investment, and also what our member states' capabilities are. I think the previous speakers have talked about that. But I think that it allows us an opportunity for member states to look at how they collaborate with each other so that we really extract value out of the regional value chains and really optimize how we work with each other. The other thing that hasn't been touched on too much, except in the context of intellectual property, is the whole question of innovation. We've got a thriving innovation ecosystem on the continent. However, we lose researchers every year. About 1 in 3 researchers leave Africa for the developing world, and with that goes our innovation capacity. And I think that, like the other speakers have talked about, this COVID-19 crisis has emphasized our need for self-reliance. And with that, we need to be relying on our own academics, on our own researchers, and our own innovation capacity. And so we need to put more effort and investment into developing and nurturing that innovation ecosystem. And we can only do that through partnership with academia, with governments, and with the private sector. And then, it's the whole question of implementation. And with that, I cannot emphasize enough the need to become really granular and very practical about implementation. Because we tend to look at implementation of policies really at a policy document level, and then not looking at what the day-to-day reality is. And I think some of the speakers have talked about some of those implementation challenges. And until we really get that right, we are not going to be able to serve the patients in the value chain that we need to be serving with medicines.